All right, everyone. Well, my name is Tim Lewis. I work for the American Heart Association as a Community Impact Director. Thank you to those who are joining right now. I see we're getting a lot of participants who are joining in the past couple of minutes. We'll give it a couple of minutes for other people to join as they do, but I wanted to kind of give a brief introduction as to how this community conversation came about and what we're hoping to really to do in having this conversation. So our final panelist just joined, so let me get him so we can have video of him as well. And Dr. Matthews, I see you just joined. I just unmuted your line. So as you join in, because we have so many people who are joining this meeting, we're going to make it so the only videos you can see at this point are going to be the videos of the panelists who are going to be addressing the question. We are going to have an active chat box. So as you join, if you would be able just to kind of introduce yourself in the chat box, say who you are. When we sent out this invitation and created this community conversation, we just really wanted to share it with as many members of the community as possible. And we really got RSVPs from a very broad spectrum of general public, heart disease and stroke survivors, different community agencies, medical professionals. So there's a very broad range of people who are on the call. We're going to try to kind of address questions from a number of different ways. And then also I just started recording this meeting as well. So we'll share out the link. So if you have anyone you want to share this meeting with once we're all done, please feel free to do that. But I'm going to go ahead and get started because we have a lot of conversation questions to kind of talk through. So I just wanted to kind of start by introducing myself. Again, my name is Tim Lewis. I work for the American Heart Association as a Community Impact Director in Dayton and throughout the Miami Valley, West Central Ohio. And the Heart Association, we work with researchers, medical experts, community leaders, businesses, families to reduce the impact of coronavirus. We are committed to supporting our heart and stroke patients and their caregivers by providing a network of resources and emotional support. Our top priority during this time and at all times is the health and well-being of all individuals and their families today and in the future. This virus is impacting all of us, regardless of race, religion, age, or gender. Also, we recognize there might be an increased risk for the approximately 120 million people in the United States who currently have one or more cardiovascular disease. And it is often more serious in those who have cardiovascular diseases, including congenital heart defects, diabetes, high blood pressure. So we thought we would have a community conversation just to talk about some specific information for cardiovascular disease and stroke patients and survivors, as well as their caregivers, as well as allow opportunity for any community members and organizations to share information and resources. So everyone who is just joining, just saying again that we have everyone's lines muted except for our panelists who are the experts. So if you would be able to introduce yourself in the chat box, that would be great. I want to go ahead and start by introducing the panelists. First, we're joined by Dr. Harvey S. Hahn. Dr. Hahn is the director of the Cardiovascular Fellowship Training Program and the co-director of the KPN-CV Quality at the Kettering Medical Center in Kettering, Ohio. He's also an associate professor of clinical medicine at Wright State University. And he's also a Heart Association board member. So thank you for being here, Dr. Hahn. We're also very fortunate to be joined by Dr. Michael Doan, who many of us have seen in the news and sharing information. Dr. Doan is the medical director of public health, Dayton and Montgomery County. Dr. Doan, thank you very, very much for joining us and for all you're doing for the community. We're also joined by Dr. Cleavon Matthews, Sr. Dr. Matthews is an orator, communicator, author. He holds a Doctor of Ministry degree. He's also a registered nurse and a licensed professional counselor in the state of Ohio. He ministers to the Bold Believers Church of Christ in Dayton, where he's been for the last 16 years. And then also, finally, we are led by Kelly Dixon. Kelly is the executive director of the American Heart Association in Dayton. Kelly oversees all Heart Association events and mission-based activities in Dayton and throughout the Miami Valley. So I'm going to start with some questions. At this point, we have 62 people who have joined us. Dr. Hahn, first question is for you, and wanted to say, as a cardiologist, what should heart patients know about coronavirus? And based on current information, what suggestions can you make that heart disease and stroke patients and or survivors should do to best protect themselves amidst the COVID-19 pandemic?
Yeah, I think the first thing to realize is COVID-19 is mostly a respiratory illness affecting the lungs, and most of the mortality, fatality is in people that get pneumonia and then develop something called ARDS, or acute respiratory distress syndrome. Now, what we found is probably in all the groups that have mortality, about 10% have overt heart disease that's known from before. So we feel that people with heart disease are at increased risk, so they need to be more careful, try to avoid exposure. Two other big things that kind of fell out so far are high blood pressure and obesity seem to also be risk factors for getting sicker, being hospitalized, or dying from COVID.
So since some are at greater risk than others of developing complications and being hospitalized, those underlying conditions, like you just said, such as heart disease and high blood pressure, why might that be?
We're not exactly sure, but probably it's age-related phenomena. High blood pressure goes up as you age. Heart disease is typically a chronic disease of older age people. And what we saw in Italy, that population was much older and a much higher mortality. So probably you're older, more other comorbid risks are associated with you, and you probably have less functional reserve as well.
Okay. Question for people who are already on medication or medications for cardiovascular disease conditions, whether that medication be a statin or blood pressure medicine or heart failure or any cardiovascular related condition, what should patients do about their medicine, their prescription medicine situation?
Yeah, this is a really good question, because the virus that causes COVID-19, the SARS-CoV-2, it actually attacks the ACE2 receptor gene. So this has been important because a lot of patients are on what we call ACE inhibitors or angiotensin receptor blockers, and those interact with ACE receptors. So a lot of people have been saying we should just get off those medications because that's going to put you at a higher increased risk of getting it or being sick from it. They just published a study about 3,000 people out of China from their experience, and whether you were on your ACE inhibitors or your angiotensin receptor blocker meds, that did not make you at a higher risk for getting the disease or doing worse. So at this point, the recommendation from the American College of Cardiology, American Heart Association, is to stay on your blood pressure medications unless you're instructed to stop them for some other reason.
Okay, excellent, thank you. Kelly, as the Executive Director of the American Heart Association, can you tell us how is the American Heart Association making an impact during the coronavirus pandemic?
So first I'll start off by saying that our mission is to be a relentless force for a world of longer, healthier lives, and we truly believe that. We are leading with care and concern first. We are trying to be innovative, and we are acting quickly because what we know is that the coronavirus is evolving and scientists are learning more and more every day as we evolve. One of the first things that we are doing is we have invested $2.5 million into knowing and better understanding the diagnosis and prevention and treatment of COVID. So what does that mean? So that 2.5 that we're investing is into short-term projects that can be turned around quickly to help speed vaccine and medication development. Second, another aspect is that we are working with scientists to develop and focus on cardiovascular implications of COVID. We are supporting healthcare professionals and scientific researchers who are on the front line every day helping with this pandemic. And then finally, we continue to support our hospitals through Get With The Guidelines platform to ensure that patients receive the most current health care based off of the very latest science. So these are just some of the ways that we are addressing the pandemic.
Okay, thank you very, very much, Kelly. Dr. Matthews, I'm gonna go to you with this next question, make your video, and say that, one common thing that we've been hearing from a lot of community members that have sharing with what goes well and people are struggling with is that we all understand that the stay-at-home order is what is best for our physical health, to slow the spread and flatten the curve. That's what's best for the health of the community. And everyone is doing the best we can to adhere to that stay-at-home order. However, it's very challenging for our mental health. People are saying their stress is through the roof. Do you have any tips or suggestions to help people cope?
Sure, Tim. There are a lot of things that individuals who are feeling this type of cabin fever can do to help them through this process with the high levels of stress. And one of the main things is to be proactive, to take control of the things that they can control, and not focus on those things that they can't control at this time. Being very intentional about creating a therapeutic type space in the home with things like music therapy, things like aromatherapy, doing little projects with the family inside the house or around the house. As long as you follow the guidelines, getting out into nature and taking some walks, even doing some stargazing, playing some games around the house as a family. All of these types of things are very helpful in coping with the boredom and coping with the stress that may be associated with being limited as far as our activity during this period of lockdown. Eating healthy as much as possible is also very helpful. Making sure to get adequate rest, getting dressed for the day, making their beds for the day. All of these little things put them in a space of normalcy that can be very helpful in decreasing the levels of stress within the mind.
Okay, thank you very much, Dr. Matthews. Dr. Hahn, one question that just was asked in the chat box is that talking about why some are at higher risk than others, why is it, since COVID is a respiratory condition, why is it that stroke survivors are at higher risk?
Yeah, I think one of the reasons is stroke people, one of the big etiologies for stroke is high blood pressure. So that's going to be another confounding factor. Also, people that have stroke are typically older. Same thing, more comorbid conditions. But also, if you had a stroke, you're probably not as physically functional as you could be. So once again, you're going to have less reserve. We see this all the time. If you have a big surgery and you have a hard time recovering, a lot of times you get atelectasis, collapsed lung, pneumonia, and that's just going to make things a lot easier for any kind of infection to go into your lungs and make you a lot worse. So those are probably some of the possible mechanisms there.
Okay, so next question, I guess, Dr. Doan, have been reading this, but can you just explain what are the symptoms of COVID-19 and say, if I develop coronavirus symptoms, what should I do?
Sure, thanks, Tim. This is a virus that is moving through the population of the world, essentially, and it's producing a lot of different symptoms. It is, however, basically a respiratory infection, and the primary symptoms of concern are fever. That would be more than 101.4 degrees Fahrenheit. That would equal 38 degrees centigrade. People have cough, and along with that, shortness of breath or difficulty breathing. They just recently, the CDC added chills and repeated shaking with chills. People also have muscle pain, headaches, sore throat. And then the interesting thing is a new loss of taste or smell, indicating that this virus, once it gets into the body, it's going to circulate through the bloodstream and may be causing a lot of different kinds of problems. People may have heard about diarrhea. That's one of the things that's been mentioned, although it's not recognized officially as a symptom. And so I think people are primarily getting the respiratory symptoms, and that's what's the problem has been. And the kind of triggers to do something more than just check with your family physician or healthcare provider if you have symptoms, and to think of something more difficult or more serious is if you really have difficulty breathing, if you're really short of breath and you can't catch your breath. If you've got persistent pain in your chest, whether you think it's your heart or your breathing, whichever. Anybody that has confusion or seems to be not very arousable, that would be an indication to get some help. And certainly anybody that's got sort of bluish lips or face that looks like maybe they're having real difficulties.
And so locally, if someone develops any of those early signs or symptoms, what should they do?
Well, I think we're asking everybody to stay at home. And so if you start to feel sick, and it doesn't necessarily have to be this, but if you need to talk to your physician or your healthcare provider, then give them a call. Don't just show up at the office, and get the advice from them about what you should do. Certainly if it's to the point that you're getting chest pain, you can't catch your breath, you're more seriously ill, then you need to go ahead and call for emergency services if that's what's necessary.
And if with that new symptom of loss of taste and or smell, if that happens, does that remain for a period of time, or do we know anecdotally if that recovers?
It seems like it comes and then it goes.
Okay. Dr. Hahn, thank you. Dr. Hahn, another question just came in. How does COVID-19 affect mast cell activation syndrome?
That's a great question. And I'm going to be honest, I cannot intelligently answer that question. So I'll pass it to somebody else.
Dr. Doan, do you have any insight into that? How does COVID-19 affect mast cell activation syndrome?
No.
Okay. Well, if we can get an answer, so Melody asked that question. If we can get any resource that, we'll communicate that to you. Dr. Hahn, another question, especially for all of the cardiovascular disease and stroke patients and survivors and those with risk factors, is that seen some numbers for heart attacks and strokes have actually gone down at this point. Any insight as to why that might be? And if you can just, we're assuming no previous knowledge and people's being aware of symptoms and signs, but what are some of the signs and symptoms of a heart attack or a stroke? And if people start to feel any symptoms, what should they do?
Yeah, so I'll answer the second question first. This is really important. What we found, there's a survey of 9 major teaching hospitals, and what they found is there's been a 38% reduction in the amount of acute heart attacks coming to the hospital, coming to the ER. What that means is patients are probably scared to come to the hospital because that's where all the sick people are congregated. What we're worried about as cardiologists is you have some chest pain, you don't want to come to the hospital, you complete your heart attack at home. A couple of months from now, you'll become a heart failure patient, not an acute heart attack patient. So if you think you're having a heart attack, then that's a serious problem. Regardless of coronavirus, you should come get looked at by someone, your doctor, or probably better yet, just come to the ER. The general symptoms are any kind of chest pain, jaw pain, neck pain, shoulder pain, or any kind of change in shortness of breath, sweats, or some kind of strange nausea. All those things, if they go on for more than a couple of minutes, they should probably be looked at because it could be leading up to a heart attack.
Okay, and then other question from the chat box. I had a second ablation for AFib, and the second one has been successful for 3 months. Am I at higher risk?
Most of the heart disease that we've looked at, and most have been blocked up arteries or heart failure, not necessarily atrial fibrillation. Now, there is an increased risk of the hospitalized, really sick COVID-19 patients developing atrial fibrillation, but we do not think that's a risk factor for getting COVID at this point.
Okay, thank you. I'm going to go back to Dr. Doan. And Dr. Doan, can you tell us any of the latest local numbers for in terms of the number of confirmed cases, as well as any information for hospitalizations and deaths? And are you able to tell us any information about how those numbers break down by age group or any other demographic information?
Sure. If we look at sort of the West Central Ohio region, which sort of conforms to our hospital systems and others, we're looking at someplace around 548 cases that have been diagnosed. The breakdown is about equal for men and women. There's slightly more women than men. The age groups, one of the interesting things is about 50% of the people are age 50 or less, and only 50% are age 50 or more, so that this whole idea about young people don't get this is not really holding up. The other thing, though, is if we look at deaths, over 75% of the deaths are in people 70 years of age and older, so that the older people are definitely at greater risk of of dying from the disease. And that's one of the things that has been very consistent and is the same if you look at it across the state. It's also about 75% of the deaths are in people 70 years of age and older. The other thing that's of interest, I think, is that the rate for Montgomery County among African Americans is about 50% higher than it is for the white citizens. So that, and we might say the Asian population is about the same level as the white citizens. The rates are about just over 20%, 20, 25, not percent, but 20, 25 per 100,000. Whereas for the Black population, it's close to 40. So that if you compare the 25 per 100,000 to 40 per 100,000, there's a big difference there. And this is not surprising in the sense that some, it's hard to find any health measurement that we make that doesn't show very similar kinds of numbers, whether it's infant mortality, whether it's cardiac disease, whether it's longevity. The Black population, we know because of a number of different factors, fares worse when it comes to health status. We also have an interesting thing, which is that about 25% of the cases are healthcare workers, and about 60% are non-healthcare workers, and the rest, they just didn't record what it was. But the healthcare workers are certainly at the front lines and are the people that are tending to have the infections at a somewhat higher rate than the general population.
Okay. Question just came in, and Dr. Hahn or Dr. Doan, if either of you could answer this. In the Dayton Metro, how available is testing at this point? I realize you need a doctor's referral. Is the testing only done in hospitals?
Hi, I can take that, I suppose. The hospitals are doing testing mostly on their own personnel. As we said, 25% of the cases are in hospital workers, healthcare workers, so that's a high population to consider for testing. And then, of course, the sickest people in the hospital are the ones that are going to get tested also. There's still the Premier Health Collection Center for testing at the University of Dayton Arena parking lot. And that requires that you have symptoms and a physician's order, and you're able to get tested there. There are openings at some places in Ohio. Rite Aid pharmacies are beginning to do testing, and we are hoping that that's going to extend to southwestern Ohio at some point in the near future. There are other places that are looking. Kroger Health, I was talking to them today. They're the ones that run the little clinics in the Kroger stores. And they're getting ready to set up a testing. I don't have too many details about it, but it's going to be on Southern Boulevard across from the Kettering College out there. So that is going to be an option that's coming as well. The big problem right now is that the hospitals are having troubles getting the reagents to run the tests. There was a point at which they had enough reagent, but we didn't have enough swabs to do the collections. And then, of course, once they got enough swabs to do the collections, then they could start doing the tests, but now they're running out of the reagents. So the testing is still limited from that standpoint. The commercial labs had a huge backup, but that has been pretty much cleared out. So they are once again able to give testing within a pretty reasonable length of time, with results coming back in 2 to 3 days.
Okay.
It's still tight, but looking better.
Great. Thank you. Dr. Hahn, next question. We've all heard the hospitals have either canceled or postponed elective surgeries so as to preserve PPE as well as to save capacity for the surge. And they can also handle patients who develop severe cases in emergency situations. But people with serious non-corona medical emergencies should not ignore them. What constitutes elective versus non-elective, and specifically to cardiovascular testing and procedures? What is any guidance on deferring those non-urgent tests and procedures?
Yeah, so first off, this is a decision made at the governor's office to cancel all elective cases at all the Ohio hospitals, and that was to expand capacity, save personal protective equipment in case we had a major COVID-19 surge. There is some wiggle room in what is an elective procedure. What is not elective is something that's very time sensitive. Like if you're having chest pain and then delaying a procedure can cause heart damage, you have a blocked up artery in your leg and we're going to have to amputate your toe or your foot, that's not really elective. But when we do any procedure in the last several weeks, the medical director reviews a case form and signs off yes or no, and you can make a case for your particular procedure. So if you have something that you feel is time sensitive, doesn't have to be urgency, but at least time sensitive, talk to your doctor. They can petition for getting this procedure done. There's a lot of wiggle room in there.
Yeah. So question for those who don't have a doctor or primary care provider, but they need to talk with someone about, a non-medical, non-emergency situation. What are their options and how can they find some resources to navigate?
Yeah, one thing now is telehealth. A lot of people are scared to go to the hospital, don't want to go to ER, urgent care, don't want to even go to clinic. You can call up and try to set up a telehealth appointment with a primary care doctor or someone else. You can discuss it like we're doing on Zoom. It's a secure chat. You can actually look at people, see what they look like, ask questions. And that's the way to get these questions addressed without being exposed to any type of infectious risk.
Okay, thank you. So Dr. Matthews, I was going to ask you next. Dr. Doan shared the information, the local information about those health disparities. And from the data that we have now, coronavirus is disproportionately impacting African Americans in Ohio, which the governor talked about yesterday, and throughout the country. The Heart Association, one of our guiding values is ensuring equitable health for all. I know this is a question that does not have a simple or easy answer, but what are some things that we can do right now to better ensure equitable health in this community?
Under an acute situation like this, I think that begins with having some type of professionals assigned with this specific task in hand, whether that's the American Heart Association having some individuals who are specifically tasked in partnership with the medical system and the Black communities on how can we best help you under these circumstances. If a lot of these underserved individuals don't have physicians, don't have any type of insurance, and then those issues may be impacting those numbers as well. So I think in an acute situation, how can the American Heart Association partner along with the hospitals, as well as Montgomery County Health Department, and then someone representing those underserved individuals from the community is the way that I would think to approach this in an acute situation.
All right, thank you very much. Dr. Doan, next question. For you, just logistically, what is the public health hotline for Dayton and Montgomery County, as well as for the Ohio Department of Health? And I can also type these in the chat box. And also, are there any other local community resources that you want to make sure community members are aware of?
Sure. The line for public health here locally is 937-225-6217. And that's open Monday through Friday from 8 a.m. until 4:30 p.m. There's a longer availability at the Ohio Department of Health. That is 1-833-427-563. That needs another number. What's the next number? It's the other way to do that is it's 833-4-ASK-ODH.
And that one is open 7 days a week.
And that's 9 a.m. to 8 p.m.
Okay.
These are hotlines. The other thing I would mention is that the Montgomery County Alcohol, Drug Addiction, Mental Health Services Board also has a warm line, if you're interested. This is for, if you're feeling depressed, if you're feeling down, if you know someone else who is, You can reach out to the mental health board, and they will have suggestions or can arrange help or whatever's needed. And their number is 937-528-7777.
That one should be pretty easy to remember. Okay, that's great. Thank you so much. And I typed those first two numbers into the chat box as well. Those should be there. Next question, Dr. Matthews. Since you have some experience working in telehealth, Dr. Hahn referred to a telehealth earlier because people are afraid to go into certain medical environments. Can you tell us, for people who aren't familiar with telehealth virtual visits, what does that look like from a patient perspective or from a potential patient perspective?
Sure, Tim. It looks a lot like this, like Zoom, usually supported by some other software that adds a layer of security to the experience. But it's much like this. The patient or the client is in the comfort of their own space, and they are having communication face to face with that healthcare provider, may it be their physician, nurse practitioner, whatever the case may be. They can also share screens. So if there are things that physician needs to show the client, they're able to share the screen and show them. But mostly it allows both the healthcare provider and the client to be safe and not risk exposure to the virus during this time. Most of the clients that I see from a mental health side are very comfortable with this arrangement in this scenario. It allows them not to have to find a babysitter in order to go in for a doctor's visits and things like that. So there's a lot of positive to the telehealth services.
Thank you. And similar question about, in a way, but how can we show comfort or support to family members or friends from a distance?
Support from a distance. Some of the same ways, taking advantage of, there are some families who can do a Zoom call for the family. And recently we have individuals who've had deaths in their family, unfortunately. And we know that funerals at this time are very limited. So one of the things they did was they created a Zoom call and allowed other family members to be able to participate in the real-time support of those who were at the gravesite. So taking advantage of these types of things, as well as social media, as well as Duo and FaceTime, it allows family to stay in contact and provide real-time support to one another.
All right, thank you very much. Dr. Doan, next question from a public health standpoint. For essential businesses that are still operating and for the businesses that are beginning to reopen as part of the phased reopening, can you tell us the requirements for social distancing as well as recommendations for wearing a cloth face cover? Are there any other necessary precautions to follow to prevent, promote, and protect public health?
Right. I think that as the businesses reopen, they're going to be, it's going to be a staged thing, and there will be instructions come out as that occurs. So I wouldn't be surprised that there will be specific instructions as businesses reopen. I think the important thing is just everything that people have been saying, we need to continue to do. Wash our hands, don't touch our faces, keep our distance at least 6 feet from people if we can. The cloth masks, I mean, it seems like, I mean, people have said, you know, how much good can this really do, you know? And just recently, there was some research that says, in fact, they're doing a pretty good job. They're doing much better than we had anticipated. So that is a good way for any of us that might have contracted the infection and still be asymptomatic from passing it on to someone else. There are also people that I think there's kind of a common sense approach. We've certainly heard from people on the call lines and otherwise that have talked to us about going to a store, looking into it, seeing that there are just lots of people in that convenience store or something else, that they aren't wearing masks perhaps, and they just choose not to enter. So I think that there's also going to be a lot of discretion, and people are unlikely to just flood back to all of these businesses as things begin to open. I think there's still a fair amount of sense that people want to protect themselves, which is appropriate. So wear a mask, wash your hands, all the things that we've been saying, and those are all still going to hold once the businesses get going, and should be being done in the businesses that are open now.
And we keep on hearing them. They're simple, but keep on hearing them because they're effective.
Well, yeah. I mean, and to go, you know, I mean, people are staying at home in great numbers, and we hear about the people that aren't doing that and the people that are sort of pushing the rules or not kind of abiding by what most people are. But the fact is, enough people are doing it that we're seeing a real effect, and that the hospital system is not going to be at this point overstressed by these cases, that elective surgeries at some point they can get done so that the person in pain waiting for their hip replacement can get that finished up. And it's going to be, I think it'll work out in such a way that we can get things reopened, take the precautions. People are going to be careful. We're going to be doing things differently. Anthony Fauci has said he thinks handshaking is dead, you know, and that's just not going to come back. So we'll have to see as people make these accommodations and go ahead.
Dr. Hahn?
Yeah, just a comment about social distancing and masks. For me, myself, I'm young. I'm relatively young, I guess, but I'm healthy. So the odds of me or my kids or my wife, who's also very healthy, dying or getting COVID-19 are very low. The reason that I'm doing social distancing and I wear a mask at work and also at Kroger's in the store is I don't want to be a vector, and I'm asymptomatic and I give COVID to somebody else, especially in the office. By definition, I'm a cardiologist. Almost my whole practice is older people with heart disease. I don't want to hurt any of my patients. Furthermore, it's easy when you're young and healthy to do whatever you want, but then you go visit grandma and then you put grandma in the hospital. So it's an inconvenience. It's not great, but we're not doing this for ourselves. We're doing this for the greater good of the whole community.
Right. Thank you so much. Next question for Dr. Matthews. As our community continues to practice social distancing and adheres to the stay-at-home order, what are some tips and suggestions for not only to support mental health and well-being, which you can speak to as a counselor, but also any other specific tips for staying active and eating healthy?
Yeah, the tips for staying active, there are many little things you can do under the guidelines, like taking a walk, as long as you're following the guidelines. There are home exercises that you can do. I've seen a lot of people having fun with little dances at home through things like TikTok. I follow Robert Griffin III, and he and his family seem to have a ball doing that. So just getting creative and going back to some of those things and our roots before all of this took place. We can have plenty of fun with our kids playing games around the house, engaging in storytelling, writing stories, acting out our own little skits and things of that nature. Anything that's creative, that's within the guidelines, I think it comes to play when it comes to our mental health and our well-being. Creativity is the key. Also with food, planning our meals, making sure that we get colorful plates, making sure we get our fruits and vegetables, and just limiting as much as we can of the ice cream, I think are some good tips.
Yeah, I just want to add on to what Dr. Matthews said, one of the big things that keeps falling out in the studies for COVID-19 is obesity. That puts you at high risk for getting disease and actually having fatality from the disease. So no one's going to become unobese right now, but going forward for your general health, it's going to be really important. The other really interesting thing is there's two large social events that happened. One was Mardi Gras down in New Orleans, and people have been criticizing that as being a big spread for COVID-19. The thing that hasn't been talked about is the LA Marathon was 1 week before Mardi Gras, and that's had almost no impact. And that's basically because most people at the LA Marathon are healthy, active, and not obese. Mardi Gras is probably not sleeping, drinking, eating bad food, and unknown obesity rate.
All right, so Dr. Hahn, several people who joined are healthcare professionals themselves. Can you give any updates on any clinical guidance that has been developed or has changed, or any care considerations for patients with cardiovascular diseases?
Yeah, there's actually been several publications, but they're very general. The problem is COVID-19 is a viral disease. Most of the treatment, most of the care is going to be supportive. So there's not a bunch of specific guidelines that we can use. The big thing is if you're on your medications, stay on your medications until the doctor instructs you to come off your medications. Basically, the most important things for just general public health, social distancing, washing your hands, don't touch your face. I think one of the biggest problems you have, masks have some impact. Gloves are probably the worst thing you can do because they just keep cross-contaminating yourself. But basic hygiene is probably still the strongest thing because this is a virus.
Okay. Another question that just came in the chat box is, how close are we being able to offer testing to people broadly for the antibodies for coronavirus to really know the people who have had it and we missed by testing and those who are asymptomatic?
Hi, I can take this one if you like. Broad testing is not in the foreseeable future. And the difficulty with the antibody tests at this point is none of them have really gone through the kind of testing that we need to know exactly what their performance is going to be. So that if you've got a test that's 95% accurate for diagnosing when somebody has had the disease, and it's 95% accurate for telling you that somebody hasn't had it, that is, the antibodies would be negative. That means if you just test 100 random people, you're likely to get 5 false positives out of that group. And so it makes it very difficult to know if a positive result really relates to having had the infection or not. This is why we do histories on people, and physicians do physical exams, and then they order the test because they're trying to make the test perform better by enriching that population for the people that actually are probably have a higher probability of having the disease. So that just kind of broad testing with antibodies will be useful at some point. But right now, what we call the positive predictive value of getting a positive test is not very, very high. And that perhaps only 1 out of every 5 tests is actually going to be a true positive, and the rest will be false positives. That'll get straightened out with time. But at the moment, it's interesting information, but it's very hard to find anything there to really hang our hat on, so to speak.
Okay, I know this is, still data is preliminary, but with preliminary and anecdotal evidence, can you speak to anything about the connection between the smoking and vaping, especially as a COVID being a respiratory disease?
Sure. I mean, there's pretty clear evidence that's smoking and vaping, and the smoking is better studied, but certainly there is clear evidence that smoking is a risk factor. Smoking is also, of course, a risk factor for lung disease. It's also a risk factor for heart disease. It's a risk factor for premature death from all causes. And so that is a behavior that just kind of sets us up to have difficulties. As a consequence, if you want to quit smoking, this is a good time to think about it. You can talk to your physician and see. Most of us are not going to be able to get from obese to normal weight real soon, but thinking about making a plan And then having a way to quit smoking is something that can be started with a little bit of planning and some thought about how you want to do it and some examination of what your motivations are. That's something that can be done even under these circumstances.
Thank you. Dr. Hahn, anything else to add?
No, I totally agree with what Dr. Doan said.
Okay. Dr. Doan, since there's so much seemingly endless questions about this, and it seems like the information can be overwhelming. Where can we get reliable medical information and timely updates for guidance?
I think any of the professional associations and organizations like American Heart Association are good. I'm in public health, and so I tend to be biased and think that that's where you find the most comprehensive information. The Public Health Dayton and Montgomery County, you go to phdmc.org and then follow it to the COVID-19 links and it will give you information. At the state level, you can go to coronavirus.ohio.gov and they will also have lots of information. The cdc.gov is an excellent site and very authoritative. The information is being generated so fast that many people are having troubles navigating when they get to CDC because there's so much information and it may be hard to find exactly what you want. So I would start more with the local and the Ohio sites to try and get information. And I think we have to be careful about a lot of magazines and the press are reporting different studies, and they tend to report out a study and it's really hard to evaluate exactly what that means. And so, let's just kind of let those studies kind of wash over us and we'll see how things go and how things eventually sort out.
Okay, and then last week at your press conference, kind of talked a little bit about what we might be able to expect next. Yeah. By doing all we have done and continue to flattening the curve, slow the spread, what might happen next? And we expect as restrictions are thoughtfully and gradually lifted.
Well, the virus is out there. It's not going to go away entirely, and so we're still going to be living with it, which means we're still going to be seeing people transmit it from one to another. And as we begin to mix more after the restrictions are taken off, we'll gradually have more and more sort of freedom to get together. And the expectation and the hope is that it can be the lifting of restrictions can be done in such a way that the number of transmissions and infections is not pushed up too high. They're going to be there. It's just an inevitable part of beginning to resume normal life. And we want to make sure we don't get a big peak. I mean, a big peak is bad, not just in terms of people being ill and the possible deaths, but also it's not good for business. I mean, it takes away, if we've got a lot of employees getting sick, we've got other people getting sick. If you got customers that are afraid to come out, that's not a good thing. So we need to kind of ease back into it in such a way that we don't have a big spike in cases, that the cases continue to be manageable, and that we try and minimize them until the point at which we've either got therapies and or some kind of vaccine or a better understanding of this virus and what to do about it.
Okay, thank you so much. And I know that, a lot of people have questions about what to expect long time in the future, but, all decisions that are being made, now or for what's more immediate, and it's sometimes difficult since things are so unpredictable, what things are going to be like months from now, let alone weeks from now. Final question for Kelly. Since many of the participants on this call are involved as supporters for the Heart Association as volunteers and donors, they also rely on the Heart Association information and guidance. Where can people access heart healthy resources from the American Heart Association? And locally, how can people stay active with the AHA?
So similar to Dr. Dunn, I'm a little bit biased also. I was on the website yesterday, and the website is heart.org, and found a tremendous amount of information. I found information for heart patients, for stroke patients. Our patient support network was on there, tools to eating healthy at home, information about stress management, and there's even virtual workouts that you can do on the website. So we have a tremendous amount of resources, and our information is science-based.
Excellent. And then for people who have been involved with the Heart Association, especially the events, high visibility events? How can people stay active with those events?
So we are encouraging walking. We are encouraging doing things with your family. One of the things that we did in my home is we are trying to eat healthier. So we are, as a family, cooking healthier. So these are some of the things that we're doing. Circuit training. I have a trampoline in my office that I brought home, and I've been utilizing that also. So you have to find what's best for your family. And Tim, can I also mention just a little bit about the upcoming virtual Heart Ball?
Yes, please.
Okay. So last month we were supposed to have our Heart Ball, and we decided to go virtual, first time ever. And the virtual Heart Ball is going to take place Saturday, April the 24th at 6 o'clock. And we're hoping that everyone can come out and register. You can register online at DaytonHeartBall.heart.org. We also have a silent auction that is taking place. The silent auction started on Monday and will run through till Friday. And there are about 75 items that you can bid on. So I am very excited about this. This is something new. We also are considering moving our Go Red for Women luncheon to a virtual luncheon, and that also will take place on June the 4th. So come on out. We're going to have a good time. You're going to be able to celebrate the Heart Ball at home. This truly is a new adventure for us, and we're excited about it.
Excellent. Looking forward to that Heart Ball on Saturday. And I typed the website into the chat box for everyone. The Heart Ball is this weekend on Saturday. And the final question, if anyone else has anything to ask, please ask in the chat box. But for each of the panelists, is there anything that we have not asked? Is there anything that what are questions that we haven't asked, or anything that we should be thinking about that we're not thinking about, or anything we didn't talk about today that you think there should have been a question about? Let's go with Dr. Hahn first.
No, I think we covered a lot of different topics. I'm glad we talked about masks. So I don't think there's much more that needs to be kind of uncovered.
Dr. Doan, anything?
I just say, as I've said before, once again, that I am just impressed with the populace of this area, Montgomery County, and this region, that they have. I think Ohio, probably better than any other state, has taken control of this situation, and that the people have really done things that the medical system would not have been able to in terms of decreasing the transmission of this virus and getting it under control, where it's likely to work out better for all of us in the long run.
Dr. Matthews?
I think that this was a great opportunity to share pertinent information with all of us. I think that all of the panelists and yourself did an outstanding job sharing very, very good information that will help to save lives. And so thank you.
Kelly Dixon?
I just want to say thank you to all of the panelists. Thank you for everyone who came out to support us. Also to, the tagline, Dayton Strong.
Yeah, I think this was the first time we've tried anything like this in Dayton. And for me, as a community impact director, I'm accustomed to being active and involved in the community and community settings and medical settings. And so it's a bit different. And I appreciate everyone taking time to join virtually. And if this is part of what our new normal is, we're going to meet people where they are, and we're going to continue to move our mission forward. And we're going to continue to do everything we can. So we'll continue to be in communication. Thank you, everyone, for information and resources. Just want to say for all of our panelists and for everyone who joined the call, we are grateful for you. We're all work to build a healthier community, and we're going to press forward together. So I appreciate everyone. I am recording this, so I'll if you would like to have a link of it, just email me. And then if there's anything else anyone needs, we're happy to do anything we can to support anyone anywhere in the community. So thank you, everyone. Appreciate everyone.
Thank you.
Thanks, Tim.
Thanks.